needle stick here for some numbing. So he's tilting just a little bit, so you can just...
This way?
Yep, perfect. Perfect. Rub that in there. Turn it on, this little green button here.
Mm-hmm.
So I'm going to make sure I'm perpendicular. I think I'm perpendicular here. I'm more probably about a centimeter in. My pressure is about 17. I'm going to take this off and let's see if I can manipulate this.
Yeah, you'd think it would be flowing fast since it's little.
Yeah, exactly.
But it's...
Exactly. But we clearly got spinal fluid, and it's not coming like... So it would suggest he's not having like a whole lot of increased pressure in his brain. Which, if he would get unhappy and cry a little bit...
Yeah, see, I told you they sleep when we want them to cry.
Is he sleeping?
He is.
But...
Okay.
Okay,
All
thank
right.
you.
Yeah.
Thank you.
He said, I'm going back to sleep.
So, but you notice though, I mean, I numbed him up. Most people, especially on the neonates, don't think you need to numb them up. I think it makes a big difference. And the literature actually says that you actually have more success if you numb them up. And so...
And they move less.
They move less.
Yeah.
You notice that.
Mm-hmm.
But what percentage of time on the little ones do people not numb them up when you're holding?
Well, I've been here 17 years, and the majority, I say 90% of the time, there's no numbing.
Yeah.
Why wouldn't you though? Like what? I mean, it can't hurt.
Right.
The issue of not using anesthesia is probably more complicated than I understand. Mm-hmm. But the sense is that they don't feel it, and it's quick. But when I was a general pediatrician, I found, this is when I started numbing them up, and I was a general pediatrician for 4 years before I went back and did an emergency medicine residency. And I found that I had more success. I found that I could sometimes feel it pop through the dura, and that just made my success so much greater. Still coming. We're making progress here. It looks clear, Mom.
It looks clear.
Yeah, yeah. You haven't passed out, Mom. You're doing wonderful. I'm going to use the compass one more time just to confirm pressures at the end of... this, but I've seen pressures from 11 to 17. Did you, is that what
Yep.
you have documented on the,
Yeah, I think the highest I saw was 19.
okay. The X on his back was because we did an ultrasound. And we're going to show some ultrasound images here. We were able to measure approximately where the depth to the dura, and it was about, what was it, guys? About 1.2.
That's correct.
All right. And I think that's where we're at with this 3 centimeter needle. Okay. Okay. So out comes the needle. Okay. This little one had the bulging fontanelle and the fever, and that's why he got the spinal tap. So, Mom, thank you for letting us do this video, and you're okay if it's on YouTube and all that stuff.
Yeah.
Okay. All right. He's a handsome, good-looking little guy. Smile for the camera, big guy.
You smile for them.
He said, "No way, no way." So basically, we did the ultrasound, and our measurements here said he's going to be about 1.2. You can see that right there, centimeters, into where the dura was. We think this. I think this was the cauda equina. This is my Mindray ultrasound machine. It's a great machine. I love it. Yeah. Okay. So basically, what we're looking at here is these are bone shadows here. All right. This is spinal cord here, and so these are spinous processes here, and this is the interspinous spaces. And this was higher up, but you can see there's significant amount of, the black I think is the spinal fluid there, and that's the dura right there. So anyway, that's our anatomy here.